Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Today we want to cover kind of what to look for when you're buying your child's toothbrush in the store. And I joked earlier that, or on Amazon, because, moms were busy and we want to order all these things online, but you can definitely find that information online. We're also going to talk about why the sizing of those toothbrushes and the bristles are important. And then we're also going to talk a little bit about toothpaste. There's a lot of debate in there about fluoride versus non-fluoride, so we'll be handling that as well. So today we're going to start off obviously with newborn. When they're first born, most kids are born without their teeth. So they will definitely start to get those teeth depending on how they're going to mature, usually around 4 to 6 months. As they're, being bottle fed, breastfed, things like that, you're just going to want to try to keep those teeth as clean as possible as they start coming in. So we have a few items you can use for that. We have something that we call a finger cot or an infant pre-toothbrush. And this is just kind of like a washcloth that's called a tender. And you're going to carefully swab the infant's gum and teeth after using, then you rinse them with water. You moisten it just a little bit, but this is just for you to wipe their teeth off after they've had anything that involves milk, which would be obviously a bottle, formula, or breast milk. And you're going to use this on your fingers and just use it to wipe their mouths. But it's very easy to do it this way. Fits on your finger. You can even put 2 fingers in there if you feel like you need to. Just whatever. We do have these available in the office. They come in blue, pink, green, and yellow. And again, they're called Tenders Infant Pre-Toothbrushes. So usually in general, if you bring in an infant and our assistants are paying close enough attention, we will provide your infant child with one of these regardless if they've become a patient or not. And again, blue, pink, green, or yellow. Okay, so these are really important. And you want to start taking care of their teeth as soon as you possibly can. So as soon as you start to see those teeth come in, let's start getting them at minimum washed off with a cloth. You can also just use a washcloth at home. Then we also have something that's really fun that we think works really well for kids, and these are called the brushies. And you can purchase these online, and they're a silicone-based brush that actually has little bristles on the end of it, but same concept. I'm gonna try to get into the frame here. Is it has little bristles on the end, goes on your finger, and you can use it to brush their teeth, okay? But it also looks like a little finger puppet for them. So these are fun for them to be able to get into that practice of brushing. Okay, so the earlier you start, the more normal it is for them to just continue on throughout the stages of life. As long as they know it's just a part of their daily routine, you can get them started fairly early. Then Oral-B actually makes a toothbrush for ages 4 to 24 months. So this is going to be their Pro Health Stages line, 4 to 24 months. This is actually a Winnie the Pooh one. And you can see on the bristles, it's just super small. Okay, so it's about the width of my thumb, I would say. Super soft bristles. It says baby soft bristles, cushioned head, and non-slip handle, designed to help parents brush babies' teeth and gums. So it's made for you to brush their teeth, but it is a way to get them started, especially when they're kind of out of that infant stage going into the older 18 months to 24 months. These are going to be good for them. Also at that age, these are safe for them to kind of hold and, start getting used to that there, okay? Then once they're out of that infant stage, so once they're at age 2, they're going to move up to an actual toothbrush. So if you haven't introduced a toothbrush between 4 and 24 months, then we're going to go ahead and start with this one. This is ages 2 to 4. With Oral-B, the character for this is Mickey Mouse. Again, it says it has the extra soft bristle. And it has a area where you want them to put the paste. And we'll talk about that a little bit, but it has a little blue cross in here, and that means that's where you want them to put the toothpaste. So it starts talking about that. It has a power tip. Bristles are designed to help clean hard to reach back teeth. A narrow head, which helps with the small mouth, and a cushion head, which is designed to help protect tender gums. And it's easy to hold handle. So all of these things are designed specifically so that the child can start learning how to take care of their teeth on their own, okay? So they're still going to need your help with the brushing, but it is important to let them practice, okay? And you can see at the top of this brush here, it says ages 2 to 4 years. Most toothbrushes that you find in the store or online should tell you what the age appropriate size is for your child. Oral-B, I think, does a really good job of labeling them very well. It's usually in the top left-hand corner of the brush. So, you can look for those things on any other brands, and they are listed on there, usually on the front or the back. So that's what you're looking for. And these have been designed by and approved by the ADA, some by the AAPD, which are all dentists who have gone in together to make sure that they're getting a good product that you can use for your child. Let's see. So once they are 4 years old, 3 and 4 years old, they're gonna start getting bigger. So you'll notice as the toothbrushes go up in stages, the bristles and the size of the actual heads on the brushes get larger. This is because obviously their heads are growing, their mouths are growing, and they're getting more teeth. So as you work into that, there is a 3 and up stage or a 3+ age with Oral-B. So that's going to be somewhere in between this 2 to 4 stage. We actually have a little bit bigger of a toothbrush. So as they start to grow, it also has a tongue cleaner on here, which is also going to help with that, and a handle stabilizer, which keeps the toothbrush steady when it's set down. Okay. So it's just when it's set down, it won't tip over, things like that. So this is for ages 3 and up. And right now the character we have in our office is, I guess this is Buzz Lightyear, but we have Toy Story for 3+. All right. And again, you can see on the top of the brush, it says 3+. Okay. So then that's going to be kind of between that 2 and 4 stage, and they start to get a little bit bigger. Once they reach age 5, they're going to be in this bigger stage. So this is a 5 to 7 toothbrush. This is Avengers. I believe this is, oh yes, this is the Hulk. So he's on the front of it. So they make these really fun for kids, and usually have the characters, and the kids normally are drawn to the characters. So I want to talk a little bit about that in a minute. And here's a girl's princess. All right. So the kids are normally drawn to the characters. So if your kid really likes Mickey Mouse and they're 7 years old, like, that's fine. This toothbrush is small enough that it would work for them. But if they're 3 years old or 2 years old and they really like Princess and Hulk, this toothbrush is going to be too big for them. So you can go smaller. You just don't want to go bigger because it's not really doing its job. It can't, the toothbrush itself isn't going to be, quote, good enough for them at that stage. Okay. So remember, you can always work your way down the stages. If they're bigger and they like a character in the younger category, that's perfectly fine. But if they're smaller and they like a character in the larger cavity, we're going to have to try to veer them to a different character. Okay. So be mindful of that when you go in, let them know, maybe give them the choices, pull them off the shelves and say, these are for your age, or, kind of know ahead of time and be picking those out up front. Again, these are some other characters that are available in the 5 to 7 stages, and they have changed these characters are changing out over time. So we have Princess Cars and Nemo Dory. But yes. And then someone is asking, what if my son is 4 and loves the Hulk? Do you think that would work? So it just kind of depends on his aging, on how big he is as a 4-year-old. I think just even, you might be able to get away with it a little bit in the 4-year-old if he's on the bigger side. These actually go up to a 7-year-old. So think about that if he's 4 and he's not really at that stage yet, you might have to make that decision, or, maybe promise it for his 5th birthday or something like that. But, again, I do want to reiterate that as far as what we recommend from AAPD guidelines is one thing, but also what you can get them to brush with is also okay with that. So maybe say, yes, you can have the Hulk toothbrush, but then mom's going to have to help with a smaller toothbrush. Okay, so he could brush with this. You just want to make sure his actual active brushing that you're helping with is a different size. And that's just a suggestion. You know, you can definitely do what you need to do, mom, to get him to brush. Okay. Once they are in this 5 to 7 stage, they're going to start transitioning into, you know, the 6 to 7, 8-year-old stage. These work for about up to age 8 to 9. So this is a 6+ years. You can see that the heads are definitely bigger. Let me see if I can get that to show up in this screen at all. But you can see as they're getting bigger, the heads are going to get much larger. So they're going to be the size of the appropriate mouth, okay? So you can see even with the width and all the bristles and everything, there is a huge difference in the sizing here. So you can see that a 5 to 7, and this is a 6 and up. So what we're saying is if your child's a bigger 6-year-old going into 6 to 8 years old, they're going to need this bigger one. But if they're smaller, they can use the 5 to 7. Again, remember, smaller is better. So if you think this is too big, and they're 8 years old or something like that, like you're fine to go down to the 5 to 7. All right. And this, as far as our office goes, I can't remember the exact name of this one, but these just have stars on them and they come in all different colors. And this is a cross action brush, which removes gunk like plaque and food particles in hard to reach areas. It also has a tongue cleaner on it, which is what you'll start to see as you get into the older stages of toothbrushes. Okay. And then once they're over, like, we could do this in 8 and up, but I would say 10 and up in our practice. We just give them a regular adult size toothbrush, which this is the Oral-B Complete Sensitive. We have this in multiple colors. You can see it more looks just like your standard adult toothbrush, okay? I know it's kind of hard to see there. Okay, so that head is pretty normal, pretty standard to what we use, okay? Then once you have got the toothbrush picked out, you know, then we want to talk a little bit about whether or not they need to use an electric or a manual. These Crest Oral-B has come out with a new electric toothbrush that we actually sell in our practice. I'll have to double check the price. I believe they're about $25 to $30 for the character ones. And these can actually be used for 3 and up. So this one says 3+. So this one is an electric toothbrush that they're recommending, and they're saying it can be used for 3 and up. Definitely with some parental supervision, making sure that they're using it correctly. All of the Crest Oral-B characters are in the Disney line, so they can use the Disney Magic Timer with that. And that kind of helps them know how long they're brushing. I want to see if this one has the timer on it. I believe this has a timer on it, like it tells them. It doesn't have a timer on it, but it pulsates when it's time for them to stop, okay? So that's pretty cool. And then again, Little Mermaid's the same way. It's a 3 and up. But the character ones are really cute. We also have a more plain version of this electric toothbrush that we recommend for around 6 to 8 years old, 8 and up, and before they transition over to the adult size toothbrush, okay? And all of these are rechargeable, meaning that they are not spin brushes. They are actual electric toothbrushes with a charger. So I feel like that's really important as a parent. If you have these spin brushes, a lot of times you have to end up throwing them away and you have to buy another one, which can make it pretty costly. But again, these are only around $25 and all you have to do is replace the heads. So electric toothbrushes are great. We have, again, the kids version is around $25 to $30. We sell them in our practice. We also have an adult size one that's about $80 and it's rechargeable. And for teenagers, it's really cute because it has we call it the selfie sticker, but it basically has a holder for the mirror that will hold their phones. So if they have a cell phone, you can actually download an app and it will Bluetooth to their phone and it will keep up with their brushing habits, and it can even send you a report on when they have and haven't used it, and it can update. And all you really have to do to get that update is just kind of walk by the bathroom and let your phone connect to the toothbrush via Bluetooth, and then it will be coordinating with you and giving you what they've been doing, okay? It also helps to show them where they're brushing, so it gives them a guide to kind of show like, okay, you've done 1 minute here, 1 minute here. I mean, we'll do a video more on that toothbrush. Again, that is going to be for an older tween into teenage years, and for adults. Okay, we do have those available in the office, and they are $79.99 plus tax. And the toothbrush, Amanda, the toothbrush that we have that's for tweens and teens is called the Oral-B Genius. And I believe the version that we have is not available in stores. I'm not exactly positive on that, but the actual package that they get with that, it comes with a full-size mouthwash, full-size toothpaste, full-size flossers, and the brush with the charger and the phone holder, all in one for $79.99 plus tax, and your FSA or your HSA would cover the cost of that. So if you're interested in that, you'll need to call the office, make sure we have enough available for what you're wanting, because we only keep a certain amount in stock, but we'd be happy to get that for you. Okay, so then on the electric toothbrushes, the other good thing about the kids version is that because Oral-B has done a really good job of creating this brush so that it has a smaller head, so it acts more like the Profi cup that you get when you get a cleaning. You can kind of see in here, here's the size of the brush here. Okay, so because these heads are all smaller, and these are regular size ones that are used on an adult replacement, all right, these can be used on the kids. Okay, so an adult replacement will actually fit on a child's toothbrush. So if you're in the office every 6 months and you need to pick up a replacement, I think ours are around $5 or something like that with tax, which is definitely cheaper actually than you can buy them in the store. And that's because we get them directly from the company. And so we don't have to go through retail for that. So we sell them to you at our cost. All right. We don't do any upcharge on that or anything. We just want to make sure that they're getting a good quality product. So again, these, I don't know how much these are actually sold in stores, the kids ones, but our packages are $25, $25 to $30. And then the adult ones are $79.99. And then our replacement heads are around $5 each, which I think even with the off-brand is still cheaper than they are in stores. Like I think a 3-pack in the store is around $20. So that's way more than $5 per item. But don't quote me on that. You might be able to find them on Amazon. We just want to make sure that you're getting their heads replaced as soon as, when they're needed to be. So the biggest thing is that heads on toothbrushes and heads on electric toothbrushes and manual toothbrushes need to be replaced every 3 months. So this comes into play with the spin brushes again. You would need to replace your spin brushes every 3 months, manual brushes every 3 months, and electric brush heads every 3 months. That is not including if someone in your house has gotten a cold or something that is bacterial that could be considered infectious or contagious, okay? So if your child gets a cold and it ends up it's going through the whole house, or you're getting the flu or something like that, then you want to switch out your brush heads. It's also a good thing as an adult, if you get sick. This whole week I've kind of been battling some allergies and things like that. It's kind of run into a sinus infection. And so I'm going to be switching out my toothbrush actually today. I like to do that every time I get sick, just because it keeps me from continuing to give myself that same bacteria. So anytime you have something that's considered contagious or any illness, especially for yourself, make sure you're switching out your toothbrush or your toothbrush heads on your electric toothbrush. And then other than that, they would need to be replaced every 3 months. And then the reason we're bringing that up is because most of you are going to the dentist every 6 months. So we provide you a toothbrush. Most kids that come into our practice will get an appropriate age toothbrush. They get a little pack of toothpaste, which I don't have the little sample size. And then they'll get a sample size of flossers as well, or manual floss. And this is not going to last them until the next appointment. So obviously you're going to need to get toothpaste, things like that. This package of flossers, it only has 3 in here. So if they're really doing good in the flossers, you're going to go buy a full-size package. And then their toothbrushes also have to be replaced every 3 months. So if you're waiting for the next 6-month checkup to get the next toothbrush, you're waiting 3 months too long. So we try to make sure that we're providing those as best that we can with your cleanings, but you will need to be buying one in between there. So you should, if you're coming to your dentist regularly, which is every 6 months for your checkup, then you would need to have 2 brushes or 2 brush heads, which we don't do your brush heads, but you would need to be having 4 changes a year. So every season you're going to need to change the toothbrush, okay? We feel like that's very important information. We want to make sure that not only are you not continuing to take in some of that bacteria and things like that, but your bristles are worn, the brush isn't working as well. Okay. And again, that's going to be on any brush, any manual brush, which is something you would just use and move on your own. And then any electric brush and any spin brush. Okay. So now we're going to move on to just talking a little bit about toothpaste. And these are as far as how our office guidelines. So we take our guidelines straight from the AAPD, which is the American Academy of Pediatric Dentistry, and we go by what they recommend. So for infants, as soon as they get their teeth, up to around age 3, 4, 5, when they're able to learn how to spit, you are going to be able to use a fluoridated toothpaste. Okay. So usually from infants to around 2, you're going to use a smear of toothpaste. So you're just going to smear it on the brush. It doesn't have to be a pea-sized amount or a dollop. Just literally just smear it on the brush, and it can have fluoride in it. And we actually prefer that you use fluoridated toothpaste. But again, just a smear is enough. You're going to brush their teeth as normal with that. Once they get to be around 3, 4, 5 years old, so you can start using a pea-sized amount. And then that would include when they're able to spit, okay? And then once they're older and they're really getting a hang of it, they can use just a little bit more. As the brush grows with them, they may, in their mouths and things like that, they might need just a little bit more. But we always teach kids in the office that less is better, and we tell them all the time that mom doesn't want to end up with the toothpaste all in the sink, because usually what ends up happening is you may think you're doing better by using more toothpaste, but most of it ends up not getting blended onto your teeth. And so it ends up just that big blue blob in your sink. Okay. So let's talk a little bit about the toothpaste. So again, fluoridated can be used at any point as long as you're using the right amount. All of these have fluoride in them. They always have several different characters. These are by Crest Oral-B. So this is a Star Wars with BB-8 on it, and then a Incredibles 2, which is one of my favorite movies. But again, this is like a pump, and then this is just a squeeze that has the ability to sit upright. So it just kind of depends on your family preference there. And then as far as just regular, they make them in kind of a bubble gum. This one's called Sparkle Fun. So it's going to taste more sweet to them, which might get them acclimated to being able to use the toothpaste. The mint may be a little too strong for them, depending on just kind of their preference. Okay. So you can make toothbrushing fun by allowing them to pick out the different toothbrushes and toothpaste. Just make sure that you're doing something that's age appropriate. Okay. And then for our older patients, some of them receive this as a sample in their bags that they get at their checkups. But this is the Crest Gum Detoxify, and it's a deep clean. And it says it neutralizes plaque bacteria even around the gum line, and it has clinically proven healthier gums. And I know that one of the ladies came in and talked to us about this, and our rep, Stacy, is super sweet. And so this is a fluoride toothpaste for anti-cavity and anti-gingivitis. So according to her, it goes down so many millimeters into your gum tissue and continues to clean. And they've actually had people that it has shown a lot of progress in them fighting their gum disease. So it is recommended for that. And we have different samples of this in and out of the office, but they do sell this in stores, and it's a little bit on the pricier side. I think this was in the $5 or $6 per box, but it's a great tool, especially if you're fighting anything with your gums. Okay. Okay. So we've gone over all that. Again, we just want to kind of reiterate to you, we have this tagline that we always say, that it doesn't really matter how you take care of their teeth as long as you take care of them from the beginning. And, we feel that's very important for you to understand as parents. I've gone over kind of the specifications, kind of what the ages are, what toothpaste we recommend, toothbrushes we recommend, how to take care of them from infants to tweens to teens, but we just want you to know that what's working for you is okay. And we're just here to kind of set some guidelines for you if you need that. But again, we had a mom ask a little bit earlier about the 4-year-old and using the better character for them. While we recommend from a professional standpoint that you use the age-appropriate toothbrush. We also understand that as a mom or a dad or a caregiver, grandparent, that getting them to brush their teeth can be a challenge. So do what's working for them, okay? Another thing we always want to remind parents of is that you are going to have to be helping them brush until they're around 7, 8, 9, even 10 years old. It's very important for them to be getting all those areas of the mouth. It's very important for as soon as you start to see their back molars and teeth start to come in and they start touching, they need to be flossing in between those teeth. I would say, I don't have the actual numbers for our practice, but the most common thing I see is they get these small cavities between their teeth because they're eating gummies, fruit snacks, different kinds of things. And it's not that the parent's not doing a good job of keeping them away from the candy or the sugary drinks. It's that they are using some type of gummy thing or something's happening and they're not flossing all of that out of their teeth. So then that just sits in there. It starts to collect all the bacteria, and then it can cause a cavity on both teeth. So it can actually cause damage to the area between both of those teeth, which then causes a cavity in both of those teeth. Okay. So if you just start flossing early, as infants into that toddler stage, be brushing, get them acclimated to that, start flossing as soon as those teeth start to touch. Continue to show them by example. If you're brushing your teeth and you're flossing and you're showing them that, then they're going to mimic you. I joke all the time that, when we're exercising or we're doing those things, our kids always want to get in there and they want to do the sit-ups and the push-ups and, jog or whatever. And they want to mimic what you're doing. So if they see you having these healthy habits as far as taking care of your teeth, then they're going to do that. It's that same thing, as exercise, even our eating habits, things like that will all be mimicked by our children, whether that be a good version of that or bad. So one thing that you can control is how you're taking care of your teeth. So if you are brushing and flossing every day and they're seeing that, then they're going to know that that's a normal behavior. I get as they grow, it's a little bit harder, to get them out of bed, to even get them to wash their hair or their face, any of that stuff, showering. But if you just continue the process of showing them what good hygiene looks like, that will include oral health care, then that will carry with them, beyond them being in your house. One of the things we strive for here at PDAO is to make sure that we're giving you the tools as parents to help your children as they transition through the different stages of life. So from infant all the way to high school. But one of the biggest things as far as our in-office priority is to make sure that when they're out of high school and they're in college and they become adults, that they have had a good experience at their dental office, as far as care and feeling like they were in an environment where they felt safe. And, so that when they are responsible for their own oral health care, their own dental visits, things like that, they're continuing to go. I've brought this up on several other videos and one of our podcasts about how we, have seen there's a disconnect between maybe people who are around ages 35 and up where the dentist wasn't as fun for us. And so maybe we didn't go back right after college. And then now we're adults and, we're older adults. We've got the established dental insurance, our established job. We're able to kind of take care of some more things. And now those teeth are in bad shape. So we're having to pay more money, where we feel like, from a pediatric standpoint, we want to make sure that we're giving you the tools and the information that you need to make sure that your child won't have that gap. Okay. So after high school, college, into young adulthood, they're continuing to go to the dentist every 6 months because as an office, we have provided the care that is necessary for that. So we hope that that's what we're accomplishing. We're getting ready to celebrate our 20-year anniversary here in Northwest Arkansas, and we're super excited about that. We'll have lots of information coming about that. But, we're starting to realize, we have employees now who were our patients. So it's one of those things where we hope that we've instilled a piece of that for them and that that's going to continue throughout their lifetime. And we want to thank you all for listening today. Remember, if you have any questions, to let us know in the comments. We'll be happy to get back to you. You can also email me. My name is Amy, and it's amy@smilesarewild.com. And be sure if you're watching this video and you don't already like us on Facebook, that you're clicking the like button on our Facebook page. And you can also follow us on Instagram at Smiles Are Wild. We do tons of fun information. We try to keep it super educational, but we also do lots of giveaways. So stay tuned for our next video or our giveaway, and we thank you again for watching. Have a wonderful day.
Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.